Hey, I'm Dr. Shah. I work with 360 Urology here in Atlanta, Georgia. Our office is actually about 15 minutes outside the city in Stockbridge. We're about 15 minutes from the airport. It's a great place to come to. If you have any questions or want to learn more about some of the topics we discussed, we'd love to hear from you or see you in our practice. All right, let's start with today's topic, which is overactive bladder, or OAB. Now, overactive bladder is a condition that is very, very common. It's common in both males and females. In women, it may happen naturally as you age. You may find yourself going to the bathroom frequently, waking up at night more, sometimes increased urgency when you gotta go, you've gotta go. You oftentimes find yourself bathroom mapping, keeping an eye on where the bathroom is at all times because you're so worried that urge is going to come and you're suddenly going to have to run or you're going to leak. It's different from that cough, sneeze, stand up, jump leaking. That's more stress incontinence. But for overactive bladder, it's more like, hey, I need to go now, and you're running to the bathroom. In men, it's the exact same thing with maybe the addition of a weakened stream or hesitancy or intermittency. And so you can sometimes see that in women too, but more so in men, and that's because the pathology is completely different. In women, it's more of a bladder problem. The bladder, the nerves, they're irritated and frequently irritated, and because of that, you just have this ongoing overactive bladder. In males, it's more so your prostate, and the prostate over time is enlarging, and because it's enlarging, it's causing this increase in overactive bladder as a result of it. Go watch our enlarged prostate video and you'll learn more about enlarged prostate. Today we're going to focus purely on overactive bladder. And sometimes men, even after we fix the prostate, you still have an overactive bladder because of the long-term enlarged prostate, and you still need to go down this pathway. So now, when we talk about overactive bladder, what are the treatment options? Well, the first thing is if you're crushing water, you find yourself really drinking 100, 200 ounces of water a day, like a big gallon of water, that's probably part of your problem. You really don't need to drink more than 30 to 40 ounces of water. Just food alone gives you another 500 mLs of water. So you're already getting a decent amount. There are some patients with kidney disease where your nephrologist says, drink more water, and maybe you do need to drink more water. And in those patients, go to 60 ounces of water, but you don't need to crush it to the point where it's affecting your quality of life. So typically I recommend about, those 16-ounce bottles of water, about 2 to 3 of those a day. And you want to focus them in the daytime, not nighttime. If you're drinking a lot of water before you go to sleep, well, you're going to go to the bathroom. So, you want to avoid fluids the best you can within 4 hours of bedtime. Fluids with caffeine or sugar, those are bladder irritants. You're going to find yourself going to the bathroom a lot. Caffeine is also diuretic, so it's going to make you build or create more volume in your bladder. Same with alcohol. Alcohol is irritant and a diuretic. So in other foods, spicy foods, there are certain foods that can irritate your bladder more than others, and so those are things to keep in mind. And so if you find yourself taking in a lot of these things that I'm mentioning, then we may want to talk about cutting back on those and seeing how you do. In general, a good school of thought is, hey, when I go to the bathroom, if I'm peeing a normal or a large amount, it's probably more volume dependent, and I need to cut back on some of the fluids I'm putting in my body. If I'm peeing small amounts whenever I go to the bathroom, I wake up 3-4 times a night. Each time I go and I just pee a small amount and I go back to sleep. And then shortly after, I'm back up again and doing the same thing because if that urge comes back, that's probably overactive bladder. And so that's less of volume dependent. Sometimes it's a combination of them. Let's say you have true overactive bladder. You find yourself going to the bathroom all the time, even having strong urges, and sometimes you can't hold it and you end up leaking. You wake up multiple times a night, usually small boys, maybe some large boys, but for the most part small boys. You've tried lifestyle changes, you've tried cutting back on fluid, nothing's really working well. You clearly have overactive bladder. Let's talk about how we're going to manage it. The hallmark treatments are meds like oxybutynin. Another one is Vesicare. There's a whole host of these. Trospium. These are all meds called antimuscarinics or anticholinergics is another term for it, okay? Then there's another set of meds called beta-3 agonists. So this is your myrbetriq and Gemtesa. Now, what are these medications? Well, in this group of medications, the side effects are dry eyes, dry mouth, constipation, so things that'll dry you out. So these meds are ones that are going to dry you out. So if you're already having those problems, sometimes they're not favored. These are also meds that have been shown to cause some delirium in our elderly. And so if you're an older individual, oftentimes I'm not a fan of meds in this category. Maybe Vesicare, because Vesicare has less of those side effects, but still has them. And so these are side effects that we're going to talk about in office if you come see me. Myrbetriq, Gemtesa, these are medications with less side effects, but not no side effects. Oftentimes, side effects could be high blood pressure, so hypertension, okay, or high blood pressure. That's probably the biggest one associated with these. Myrbetriq has a lower and a higher dose. Gemtesa has much less hypertension, and so for patients that do have high blood pressure issues already, then Gemtesa is a great one, but it's a newer medicine and it's tougher to get coverage for, so we just keep that in mind. Sometimes getting your insurance covered can be a challenge, but those are your classic medications. Now, let's say you take these meds and they don't work. What are other options? Botox is another one. And the way Botox works is that this is your bladder. We go into the little camera and we inject medicine directly into the muscle of the bladder. And what that medicine will do is it'll relax those receptors and essentially block those receptors and reduce the amount of overactivity that you have. If it works too well, you can go in retention because it relaxes too much and now the bladder can't even squeeze. It will wear off with time, but sometimes you have to self-cath or keep a catheter in until your bladder kind of kicks in. So just kind of keep that in mind, okay? So Botox, working too well, retention. It's about a 5% or less risk, but it's not a 0% risk. The other problem with Botox is that you have to do it regularly, so usually on 6-month intervals. And so you do it is a minor treatment in office. You don't have to put you to sleep for it. We can numb up the bladder and do it, but it is a treatment you come in for every 6 months. And sometimes you have a regressive effect, so if you've been at it for a long time, sometimes you have to give your bladder a break and then come back and do it. Another option is a spinal nerve stimulator. Or something called PTNS, which is tibial nerve stimulation. And then there's some newer treatments related to these coming out. But in general, the way these treatments work is they stimulate nerves that affect the bladder, so the nerves of the bladder. And think of it this way, imagine your bladder or the nerves to your bladder being always angry. So imagine you being always angry, right? Irritated all the time. Well, if your best friend, which would be these stimulators, came and just patted you on the back all the time, then you would be relaxed all the time. Eventually, you'll get so used to that pat on the back that you won't notice it anymore, and you'll start getting angry again. And so then instead of patting the back, you can change the way the stimulation is, and now they will flick you or something to get your attention towards away from the thing that is irritating you, making you angry, and towards your friend, which is relaxing you. That's essentially what these things do. They stimulate the nerves and distract them so that the nerves are constantly irritating the bladder is able to calm down, and then you regain that control. And then sometimes your bladder gets used to that and sort of returns to its normal state, and you're able to change the signal or repeat the signal, and it's able to calm down again. Okay, so these are ways to kind of calm it down, and we can talk more about how it works. They're minor procedures. This is an in-office treatment. Typically, you'll do it for about 12 weeks. This one is a procedure that we do in the hospital, although we do have a test run for it to make sure it's going to work. Where we put a tiny battery under the skin, and with that tiny battery, it's constantly stimulating you. That battery tends to last 10 to 15 years, and it can calm down your bladder that way. These are all great treatment options that to consider. There are hopefully extremes that we should never even ever talk about, like removing the bladder and things like that. That's really for patients that are just so debilitated by the overactive bladder and are left with no other choice. But there are more minor procedures that you could consider, like putting a catheter in, not favored at all, because it increases your risk of bladder infections and things like that. And so there are other treatment options, but again, these are treatment options. And if you have enlarged prostate for men, you always want to treat the enlarged prostate first, because that oftentimes fixes the problem. So if there's a specific cause that we can treat, we will always treat it. If it's dietary, well, let's fix that. And if it's none of those, then this is our treatment algorithm. Okay, until next time, thank you again for joining us.